When did you first experience migraine symptoms?
I started experiencing migraine 2008.
In 2018, I think I was in 300 level then. I didn't really understand what it was.
And I was abusing drugs. When paracetamol stopped working, I started using other pain drugs, pain relief drugs.
So I think for me, I had the adult version of migraine.
It was so difficult to the point that I couldn't read. I'll have to cry myself. I abused paracetamol that period. I'm not going to
Taking too much paracetamol actually is not good for your headache. It's actually bad for your headache.
When you tell your colleagues I'm having a headache, it's just an headache. It's just an headache. And migraine is more than an headache. It's a neurological disorder.
I think for me, migraine affected my work more than it affected my daily life.
When I started working, it was tedious because working in a hospital is not very easy.
I had to take some days off, then I had to take a week, then I had to take the rest of the month off.
I would cry sometimes. I don't think migraine is something that is widely spoken about, so not everybody knows about it. I've heard it's a spiritual attack, but no definite, as to what kind of spiritual attack it is.
One thing migraine does well is it impacts quality of life.
Hi, my name is Habiba. I'm here with Ola, Maryam, Khairat at the Migraine Outreach. We're here to talk about migraines.
As you will know, that migraine can begin at different life stages. And for you, Miriam, when did you first experience migraine symptoms?
I would say it started from in 2018. I think I was in 300 level then. And yeah, I can't remember, maybe around 20 or 19 thereabouts. And I didn't really understand what it was because everybody kept saying it was just headache, just take paracetamol, sleep, rest. But it wasn't working. I just didn't really get, to understand what was going on with me.
From what I can remember, I started experiencing migraine 2008. I was still in secondary school then, and I would always go to school with paracetamol. But what I knew was the headache was destructive and it was always frequent. When paracetamol stopped working, I started using other pain drugs, pain relief drugs like Busca and the rest, and I was abusing drugs.
Okay, so I think for me, I had the adult version of migraine because mine started a few years ago. So I'm still getting to understand the symptoms. I'm still getting to understand it as a whole. But at the very beginning, I think I was told it was just a headache. I had to take 3 months off work because it's like you said, disruptive. It's completely demoralizes you. But yeah, that's it. So Khairat, tell me, can you describe a typical day when you have a migraine? Like what happens in your body? Does anything change emotionally, physically?
Okay. Physically, it disturbs my daily activities. Assimilating, probably if I would need to study, assimilating would be very difficult.
Yeah.
Maryam, what about
For me, it's, there was a time it was on and off. So I think when I was in uni, it was mainly difficult because I had to still study for school and all of that. But it was so difficult to the point that I couldn't read. I'll have to cry myself. And I was staying in a hostel at that point and the noise was excessive. I did not like noisy places at that point. I didn't like lights. I wanted everywhere to be dark. I wanted everywhere to be quiet. That's what it felt like for me at that period. And it was hard coping because sometimes when I have to explain to my friends or my classmates oh, this is how I feel, it felt like maybe I was exaggerating the whole thing. And I think she mentioned something about I abused paracetamol that period. I'm not going to abuse paracetamol because I was taking too much of it because I felt, okay, maybe if I take too much, I would feel better, but I did not.
Following up on what you said, taking too much paracetamol actually is not good for your headache. It's actually bad for your headache. So there's a recent guideline by the International Headache Society that taking NSAIDs and also some acute treatment for migraine should not be taken more than 2 to 3 times a week to an average of 10 times a month. So if you're abusing paracetamol, you are putting yourself at risk of something called medication overuse headache, which is even more difficult to treat. That's why we are having cases of chronic migraine. And you don't want to get into that space because it makes the headache even more difficult for healthcare professionals to tackle. Right. So, like you rightly mentioned, while migraine and headache disorders does not necessarily kill people like that, like cancer and also other NCDs like diabetes and hypertension, one thing migraine does well is it impacts quality of life. Right. So, for you, Miriam, how has migraine affected your relationship, particularly with family, friends, and also at work? How did they perceive you because of migraine?
Okay. I think after school, it stopped a bit and then it came back. And I think I told my parents about it even when I was in uni, but they just felt, okay, maybe it was school stress, over time. Maybe after school, you're going to not have it anymore. Because I don't think anyone in my family has probably experienced it. I think I'm like the first person that they probably know. And then when it started again, they were wondering why it was, because I think it was lockdown time. And I think we actually went to the hospital. I can't remember the name of the drugs I got, but it did not work. I remember it did not work. And I made sure I finished my medication completely. As regards to work, when I started working, it was there because I had to do night shifts, morning shifts, and all. And it was tedious because working in a hospital is not like very easy for me. So I felt a type of way having to take excuses a lot of times when I'm at work. So most times I just suck it up and I would cry sometimes, take painkillers just to get by and not tell anybody or not say anything. It was difficult for me.
So, Khairat, how does that relate or applies to you in terms of relationship with work, family, and even loved ones?
Okay, for family, my parents now understands when I said whenever I tell them I'm having a migraine, everybody will give me space. They would make the my space comfortable for me, no light, no noise. For work, when you tell your colleagues I'm having a headache, it's just an headache. It's just an headache. And migraine is more than an headache. It's a neurological disorder that affects your daily activity. So at work, sometimes when I tell people that I'm having migraine and I already know, they will just say, it's just an headache, it's just an headache. Me, myself, I'll give myself that space because I know it's going to affect me. So probably I'll just go to the morgue, so I'll find a place to just stay and I'll be alone. I might get query after that, but I just know that that space alone is what I need, and that's the only thing that can help me. Then there are some activities like some of my friends will go. I have two friends that would go out of their way to get medications for me. Some will even give me money that we take go and get medications. Shout out to two of them. Sorry, please, I'm doing that. Ibrahim and Alima. Thank you very much. Why my friends, some they'll be like, let's go out. There's sometimes that you want to go out, but you won't be able to because you cannot tell when migraine will come. You can be this kind of person shouting and partying, and the next minute you're just cool, calm, trying to like face the reality of life. Migraine is another thing on its own. So it's kind of difficult to explain to some of them. And I've gotten to a stage since 2008 till now. I've gotten to a stage if I should tell a friend that I can't go for a party and the person still want me to go, I'll just like, you're on your own. This is my life. Migraine is my life. And party is another thing. We would meet later, and if you want to understand, it's fine. But if you're not going to understand, I will just leave you. And now where we are now in the world is day for you. So if you are for me, good and fine. But if you're not for me, I would let you be and I'll give you a space.
It's funny because it's actually very relatable. I think I'll relate a lot with Maryam. I had to take time off work. Yes, hospital work is very stressful. So by the time you are battling with migraine and then you have to do a lot of shifts, one of the things that also affects migraine is quality of sleep. If you're not able to get a proper quality of sleep, it would definitely cause migraines. So a lot of times it got to the point where I had to take some days off, then I had to take a week, then I had to take the rest of the month off. Then I just walked off to my boss one day and told him, please, I just want 1 month without pay. Because you can't explain to them what it is. And the fear for me was after I took the break, I didn't want to go back to work feeling all of that again. But I still had my colleagues that felt, she's been so dramatic, especially because they have been doing the shift for so long. And then I recently just joined barely 6 months in and I'm complaining I have headaches. And now started feeling like you're just too lazy to work, things like that. So I think for me, migraine affected my work more than it affected my daily life. My family still don't get it. They're still on the verge, like I said, adult migraine. So we're still on the trying to explain to them about it, things like that. Have you experienced any stigma?
Stigma. Okay, I would say at workplace, there are some people that will just be like, headache, headache, headache. She's always complaining about headache. Okay, there's someone that I've worked with. She's also a migraine patient, but there are some people that water might work for you. There are different therapies that might work for you. So she's this type of person that water therapy works for her, and aside from that, she does not go to work. She's retired. So when I complain I'm having headache, she's just like, you headache, just go and take water. It's water that works for me. So there are people that would not understand what you're feeling. Though she's a migraine patient also, and she's supposed to understand that, oh, this is what I'm feeling. But I think for her, she just believe you're too small to have migraine, and water works for me, so water should work for you.
If I understand correctly the question, you asked if she, yeah. I think maybe because I isolated a lot, I don't have stigma because I opened up last year to my workplace, to colleagues, to management, and all of that. So I was mostly isolating, but my parents knew, my siblings knew. They try to help when they can and when they can't. Because it was not until last year before I saw a neurologist. So I was isolating basically and just doing self medication and just doing whatever I felt was helping me at that point because I felt like people would not understand and I didn't have the patience to start explaining to them. And I don't think migraine is something that is widely spoken about. So not everybody knows about it or have given it like a lot of thought compared to like other illnesses, if I would describe it as that. I think that's it for me.
So, Miriam, you said you're basically self-medicating. So, self-medication is not good, by the way.
Yeah.
So, speaking about seeking care, so how have you sought medical care since you observed migraine symptoms first in 2018? And what kind of care did you receive? How did you feel even seeking care for migraine? How did the care make you feel?
Okay. In 2018, I didn't really get any care because when I went to the school clinic, they just gave me a lot of paracetamol to take for days. And when I was done with that, I think then around 2020 was the first time my parents took me to a hospital for that. And I did not see a neurologist. I just saw a general doctor, we prescribed painkillers, but I can't remember the name of that particular one. They did not work, but I was just managing myself for a while or for a long time. I think it stopped. When I finally saw a neurologist, I think it was better. I would say it was a lot better. I got a better prescription. I even got a lot of rules and regulations, instructions to follow and not to follow. More like lifestyle moderation to help me manage all of it. Although I did mention to him about the overdose of previous medications and all of those, and he was able to help. Yeah, I think seeing a neurologist has helped me over the long run. I would say that.
Khairat, how about yourself?
Okay. Would I okay? Seeing medical practitioners, whenever I go to the hospital when it started earlier, I would complain to them that I'm having migraines. They would be like, "Do you understand what migraine is?" And when we have to like I have to explain what the symptoms is, they will not be like, "Oh, you are correct." But they might say, okay, go for this test and this test from there. You know, some hospitals following up is actually not easy. Probably my activities and their activities, I hardly follow up. 2023, I visited the hospital in Ibadan, Vine Branch Hospital. I met with Dr. Afolabi, and it was me explaining myself to him really helped me. He told me I should get a diary. I should write my daily activities for a month. I should know my triggers, my lifestyle, like she said, lifestyle, my food, the drugs to take, what's like things to do. And all of a sudden I noticed exercising helped. So with exercising, I think I'm much better with that.
Mm. I think for me, I know we spoke about working in the hospital. However, I think when I started having mine, it worked to my advantage because I got an easy access to a neurologist. It was kind of just straightforward. In fact, I didn't have to go through that whole process and whatnot. So yes, he did say, headache diary, but then I'm not a diary person, so it never worked. So I had to sit and understand once the symptoms start, like it starts mildly. So once it starts, I had to sit and realize he gave me a couple of treatments. Um, but I think working in the hospital made it easier for me to get help. It had its own stigma and whatnot, but it was I was received warmly. He was quite considerate. He took his time to explain to me as he was a neurologist. I don't know if I was not working in the hospital, if I was just a patient, I had come in, if I would get a different treatment. I actually don't know. But the added advantage for me was I was a staff at the hospital. You spoke about exercising and lifestyle modifications and things like that. Can you tell us what coping strategies or treatments worked particularly for you?
Water therapy. Early in the morning, I will take warm water, like a whole bottle of warm water. It helps because, like, like your system you would, should I say, you date for a long period of time, and it helps. Then exercising has helped me a lot. Then our normal migraine drugs, Matripan, I would use that. There's this magnesium supplement that you would put in water. That also has helped.
Hmm.
Besides person.
um, aside first of all, I think there was a time I used diclofenac as well. Um, After that, I would I would say till now I have not figured it out. Yes, just to be on the safer side, I've not figured it out because when I spoke to the neurologist and I explained to him the things I've been doing to manage it, he didn't really seem impressed. More like he said, okay, you know what? You're just making things difficult for yourself. Because I told him every time I go back home, I want the room dark. No lights, no curtains, nothing. I just want everywhere dark. Then I'm on my phone and doing whatever it is I need to do. And he suggested that was not right. I need light, then reduce my phone light, my laptop lights. So that I don't get my eyes don't become watery and all of that. The side effects of too much screen and all. He mentioned a lot of things for me to do and not to do. Um, he even mentioned that the seasoning for noodles, I shouldn't use that when making noodles because I mentioned to him that I had a lot of noodles when I was in school. So he asked that I reduce that. He also mentioned there's a particular salt that's not iodized. I can't remember the name. I think they call it white something like that. So he made mention of that. If I eat a lot of roadside food, I shouldn't do that. He just mentioned, he made sure I brought a paper to write the list of things he doesn't want me to do. Yes. And then he now gave me my prescription. But I think I've been following that. I've been managing that, but I still cannot tell you these are the things I've done to avoid and not to avoid, because I've been trying to take a lot of water, rest, sleep. But funny enough, when I started my sumatriptan prescription for the very first time, immediately I finished it, I had a migraine in the middle of the night. Like from sleep, I had the migraine, and I was so angry because I was wondering why I was having migraine when I just finished taking 6 days sumatriptan medication, and I was very angry. And I didn't know how to feel at that point because I just finished taking my medications,
What did you
doing
do wrong?
everything. So why? So I can't say I have a definite plan or strategy that I've figured out, but yes, I've done lifestyle modification. I didn't mention. Okay, so when I saw a general doctor last year, they suggested I take Coke because it had yes, caffeine, and that caffeine would help me. But I realized I was getting addicted to Coke because every day I take one bottle. I will try to not take too much so that it will last me the whole day. But then I realized in a month, I probably have like 30 bottles in the house because like I'm keeping counts because I wanted to know if I was getting addicted or not. And when I realized that, I had to stop taking it. And I also mentioned to the neurologist, and he said, yes, I should stop doing that and not take um any liquid or any drugs, anything that has caffeine in it. I shouldn't take it because that would suppress it for the time being, but in the long run I'll still suffer migraine, which will not eliminate it, and it was not going to help me. So I think I do not have any particular strategy at this point.
Yeah, yeah. So I'll thank you, Maryam. Migrant journey is actually largely individualized, right? So what works for Khairat may not work for Habiba, and definitely the chance of working with for you is slim. But we have some case studies that it can actually work. So on our website, we have some common food triggers um, for our local culture and our food. So I just want to read one of them. One of them is fermented foods, ogiri, iru, burukutu, right? We have dawa dawa, kenke.
Yeah,
So on our website, we have a list of them. So one of them also is spicy and salty food, bouillon cubes, heavily seasoned dishes.
Yeah.
All right. So also, caffeine is double-edged.
Yeah.
So it can work for you as a treatment and also as a trigger.
Yeah.
So it takes wisdom, right? And also the discretion of an expert to be able to manage that effectively for you. Most of the common migraine treatment available in Africa contains caffeine,
Yes.
right? You see paracetamol and caffeine. And as good as it can be, it can also be the reason why some people's migraine can last for as long as possible. Right. So you rightly mentioned some treatment work for you. So how do you manage migraine attacks in places you do not have treatment? You went to a party and attacks begin. You are driving and attack begin. So how do you manage yourself?
At least I don't drive, so I'm safe when it comes to that. Because when you get the migraine attack, you become, for me, I become disoriented. Like I'm confused, and I'm asking myself, okay, so what's going to happen? At that point, most of the times I just leave. If I'm at work, there's always like a room I can go to lie down, consult room, an empty room or something. I just go there and lay down. Um, But if I'm in a public space, I live there, I go home. It doesn't matter. I just want to go home at that point because, like, already I don't like excessive noise. So me being outside is me trying to be there, just not to isolate myself. So once it starts, I just want to go home. It doesn't matter where I am, who I'm with, because at that instant, if I'm not able to take my medication, I need an ice bag. Ice bag helps me, and I need it on my head for a very long time. And that is not something I get outside everywhere or anywhere. So I just want to go home.
Okay. For me, it's just to get a cool place. I would leave the vicinity, probably where there is noise. Get a cool, calm place, a dark place, and I would just relax till I feel better. Then probably just go back to wherever I am. Like for the ice pack, she said there's something I saw online. A migraine relief cap is always in my freezer. I would bring it out and put on my head, and that's all. It works because there's mint there and I love it. With aboliki, I'll add more, more aboliki, and I think I get better with that.
I think for me, now the downside of being a pharmacist, I'm not sure I have a point where I don't have medication with me.
Yeah.
I try to always be prepared. And unfortunately, because I know it's a regular thing for me, and it's either I'm hardly at home. I think I spend longest at work where I'm exposed to medications. At home, I have my own set of medications. So for every bag I have, I apparently have at least a painkiller. So I've never had a situation where I would say, okay, I'm having an attack and I don't have any medical. So the downside of medical field. So one of the greatest myths about migraine is a headache. No, migraine is just a headache. Emphasis on the just. So I know we've heard a lot of other myths and lots of cultural beliefs about that. What cultural beliefs or myths have you heard about migraine?
Okay, for me, I don't know. Some people will tell you stepped on a water, like probably someone's head. They've washed someone's head and you stepped on the water. That's why the headache is still recurring. And even me myself, they will tell you, oh yeah, come, there's something. As I'm going back, my parents told me to get a black soap. They'll mix it with some leaves. The head that it works for migraine. They'll still wash my own head and still pour the water away again. So I don't know. So I don't know. But now since people use this WC, so now what they will do is they'll pour it in WC and but still yet it comes. Sorry that they are mommy. I don't believe in this other thing. I believe medication works for me better. You can say, okay, you are doing this and it will leave you. The next minute, you're still having the migraine. So why are you washing my head? Pity me and let me just use my medication, please.
Okay. For me, I would say I've heard it's a spiritual attack, but no definite, as to what kind of spiritual attack it is. Because I remember during lockdown, when I was seriously experiencing it, and I told my parents they need to take me to the hospital. Like, I need a professional help because I don't think I can manage this anymore. Before we finally went to the hospital, I think my mom called a relative or something, and they were on the phone and they were talking about it. And the relative kept saying, oh, it's a spiritual attack. Somebody wants to do something to her, And I'm like, no, it's a headache that is more than a headache. So you people need to, we need to see a doctor for this thing. Like, it's not just, what, I couldn't believe they were saying it was a spiritual attack because, I didn't believe that. I never believed it for once. We ended up going to the hospital, yes, but listening, having to remember that scenario about, oh, it was a spiritual attack, and no, it's not. And when I finally saw a neurologist, and I'm like, oh God, these people, you people are just deceiving people here. You people are not even you people don't know anything about this thing. You just sit down and you're cooking things up, I've never believed. Yeah, maybe I thought, they'll say, oh, migraine is just a headache. And I believed it when I was in uni that it was just a headache and it was refusing to go. And everybody said, oh, it was exam stress. I was thinking too much, maybe the pressure, trying to graduate and all of that. But even if stress contributed, I don't think it was spiritual. It had nothing to do with any spirits from anywhere or anything, honestly. I think that's it for me.
Yeah, thank you. So we're in Africa. We cannot exclude the cultural perspective, and anywhere there is no medical basis or medical awareness of a particular illness, we in Africa will ascribe that to something.
Yes.
We'll find a solution somewhere else.
Yes.
Right? That's why we're having this conversation, to raise awareness that migraine is not just a headache. Migraine is actually a complex neurological disorder that can be treated and should be treated. Right? So, and one of the things that we're very big on at Migraine Outreach is support system. Right? As we can see with many of the NCDs, non-communicable disease, cancer, diabetes, mental health, and the likes, we have a very strong support system, right? So if I may ask you, Miriam, have anyone supported you in this journey? Be it family, friends, worker, have you received some form of support in your journey?
Yes, I have. Starting off with my family, especially my mom, she's always sad when it happens, especially when I'm down, like when the migraine is actually happening, like the attack is actually happening. She's, oh, I wish I know what it is and I could help. Because I'm sure, because I've told her a lot of times it's not spiritual. So it's just for me to get a perfect diagnosis and maybe treatment. So she's concerned and down at that point, but she always is willing to get me my medication. She asks me, oh, what medication are you on, so I can get that for you. I think that's something that's helped. And even my sisters as well, when they're around me, they're not always around, sometimes they're in school, but when they're around, they help me. And when I opened up at work, because we had a neurologist that comes to the clinic, but I didn't really see him on time. So, but when I finally did and I opened up to my colleagues about it, I think they were more warming, welcoming, understanding as to what was happening to me. So every time I now mention, oh, I have a migraine, they'll be like, okay, you know what, I'll cover your shift, go and rest and leave this place. It's too noisy. They try to just make the place a bit comfortable for me, and just be supportive. I think I've had few people.
So it's okay to say shout out to your mom.
Yes, shout out to my mom.
Yeah,
and my
your sisters
and my colleagues.
and your colleagues.
Yeah.
All right. So, Khairat.
I think I would say shout out to my sister, because I think she might not understand it, but she gets it. So she tends to get what I need without even saying it, And then obviously there's my colleagues, the back of what, but yeah, my sister, through and through, like she's my G. So one of the major things we do at Migraine Outreach is to lend our voices. The whole point of having conversations about migraine is to talk about it, share migraine literacy, literally. What would you like people to understand about migraine, especially in your community, people around you?
I would want people to know that migraine is not just a headache. It's more than a headache. It's a neurological disorder. So Migraine Outreach now is kind of helping, like now coming out to say, to explain our experience is like creating awareness for people to know that this is what migraine is all about.
For me, like she said, it's not just a headache. And I think it's more than just taking painkillers and paracetamol. I would always say my first advice is seek to see a neurologist. I think that's the professional that is your first encounter. Yes, so that you can get a proper diagnosis. Um, yeah, I think mostly that, because aside that, there will be definitely be lifestyle modification and all of that. So I think that's something they need to look out for. And I think there's already an awareness of a healthy living or lifestyle for people. Like these days, everybody's always talking about going to the gym, eating healthy, and all of that. So I think that's something they can look out for as well. But it's not just a headache. You need to seek professional help. First of all, see a neurologist. That's what I'm
Yeah,
saying.
I think to add to that, I think I would want people to understand that migraine patients are not lazy. There's this understanding that, and migraine patients are not trying to boycott or get a shortcut through work, or they're not just trying to play smart or overreacting. Yes, exactly. Things like, I want people to understand that it's literally a disease like you're having malaria, typhoid. It is destabilizing. So nobody would just willingly, I wouldn't just come willingly to come and apply for a job just to not be active. So I think people need to, it's something I want people to understand, that migraine patients are not lazy, they're not overreacting, and they need support.
Yes, support is the word, right? I strongly believe chronic illness like migraine should not be suffered alone, right? And for too long in Africa, there has been a silence around migraine, and we are trying to change that. So, Miriam, what does advocacy mean to you personally? So, what made you decide to go beyond just living with migraine to talking about it? Not everybody has that. Now that we're in a place where people don't really talk about migraine, but you've gone beyond to say, okay, I want to go above and beyond to speak about migraine.
Okay, I would say for me, the advocacy is talking about it, just like creating the awareness now, because I feel like we don't talk about it enough. In fact, I don't think I have met anyone that suffered migraine, like growing up or ever since I started experiencing migraine. So I would say, yeah, creating an awareness is part of it, and being an advocate for it is so that people can be aware of it as well, so that people can seek help, people can come out and speak up. Because I think speaking up now is a good thing, and it has helped, because all the times I was worried about it and isolating and all of that, I don't think it helped me. But I don't think it is enough, even as it is. I don't think it is enough, because I don't think I know anyone close to me that has experienced it. But I feel like there are people that are experiencing it, but they are unable to come out to explain that this is it. Maybe because the people around them are not understanding. So I think this awareness is part of me coming out to let them know that they can come out, they can reach out. I don't know how, on the platform, to seek help, to seek support from the rest of us. We can talk about it like what we're doing, so that they can see how they can also get help for that.
Khairat.
Okay, creating awareness, like you said, and advocacy, and just for people to know that we are not alone. You are not alone if you're having migraine. Speak out, let people know we are not overreacting. We are saying our pains, we are letting people know our pains.
Mm-hmm.
So creating awareness majorly, and I just hope we get support from people, even healthcare providers, like migraine outreachers, been doing great for us. I think it's majorly awareness. Migraine drugs should be kind of affordable for some people. Some people don't really plan on migraine drugs. What they take is just thinking.
Maryam.
Okay, I think for me, when it comes to healthcare professionals, first of all, I need them to listen. You need to pay attention to your patients. Like you need to listen. You're not just listening because you want to prescribe medication and send them away. No, and you need to listen because you want to understand them, understand where they're coming from. Because I want to. I'm not saying I've made a research, but I want to put it here. I want to put it in this way that I'm sure and certain that a lot of people who have suffered migraine or are suffering migraine started off self-medicating, like me, for example. So if you finally decide that you want to see a doctor and then the doctor is not listening to you or just making it look like, oh, it's just stress, or they ask you where do you work and you mention somewhere that is very busy. For example, you tell them I work in a school, I'm a teacher, they tell you, oh, the children are always shouting, they're always making noise. That's why when you go home, take this for 3 days and sleep and rest. I don't think that's what it is. I want them to listen more. I know not everyone can afford to see a neurologist, but seeing a neurologist is expensive. Mine might just come up as free because I was working there. But first of all, before you even see a specialist, they'll always recommend, oh, see a general practitioner first before, so if they can't handle it, you go. So like I still said, they should just listen, and all of that. When you prescribe a medication and the patient comes back to say it's not working, then you can now resort to, let's say, a specialist and see what we can do for you and keep prescribing the same medication. And if they're not certain of other ideas or advices to give, I don't think they should do that, so that they don't make patients get addicted to things that they're not supposed to, or take things that would probably be harmful later on in life. I just want them to listen and pay more attention.
So what about policymakers?
As for policymakers, I would say they need to create more awareness. I don't think we even have like a lot of neurologists in the country. As for medications, I can notice the medications are always controlled, oftentimes, and of course, I started the trial medication. I think I was able to get that with a prescription, but when I didn't have the paper. But the other medication I was supposed to get, I had to bring the paper itself before they can sell it out to me, which is understandable because they don't want people to get addicted to those kind of medications. They want to control and all of that. But I still advise that some medications are accessible and a bit cheaper so that people can access it and be able to buy it for usage. And then awareness, like I said, and you go to some facilities and they tell you they don't have a neurologist, you have to go to a private hospital to get one and all of that. So I think they need to also get involved in all of this to just help things better for people suffering from migraines.
Okay. So speaking about specialists and neurologists is not a Nigerian problem. It's an African problem and also it's a global problem. So, for example, in Nigeria, there are roughly about 80, just above 80 neurologists, or let me just say less than 100. That's even a lot. Some African countries don't have a neurologist. Some countries have just about less than 10 neurologists in the whole country, right? So it's actually a global phenomenon. Even in the US, they even have headache specialists, right? They're still complaining that they're not enough, right? So that means that everyone cannot see the neurologist, right? So, but there have been some conversations, and it's a reality that migraine and headache disorders can actually be tackled even at the general practitioner level. But the level of migraine education with these people is very, very low, right? So there have been some policies all around the world that I've been following that they want to, but it's a long short game. All right. So that's why we're also creating this awareness and also ensuring that our healthcare professionals also hear this. So every day people get diagnosis of new disease, right? So what advice would you give someone newly diagnosed of migraine today? Or any encouragement as someone that had migraine from 2018, from 2003? 8, right? So what advice would you give someone newly diagnosed today?
First off, don't abuse drugs.
Don't self-medicate.
Don't self-medicate. Don't that also see a doctor. I know we would all go online and read a lot of things like we spoke earlier about caffeine being a double sword thing where it will help and at the same time cause other side effects and all of that. I think that's where the aspect of seeing a doctor comes in so that a doctor can at least guide you on the appropriate medications and lifestyle modifications that you need to do. Um, basically that because I can assure you that there are things you have to stop eating and stop doing for you to see changes or for you to get better. Yeah.
So Khairat.
Okay, for me, I would say for you, newly diagnosed migraine patients, you are not alone. Know your triggers, work closely with your healthcare providers, then speak out. You're not alone. Take your medications, listen to advice from like people like us. Our advice might not be good, but at least with listening to us, the kind you like me online now has really helped me to know one or two things concerning migraine, aside from meeting doctors. And though I would meet doctors, you meet doctor, I would hear from you, then I would use that to know, okay, this is what migraine actually means, and this is what I'm to do and what not to do.
I think in addition to everything they have said, I would listen to your body.
Yeah.
Everybody's migraine is actually different.
Yeah.
Everybody's senses are actually different. So I would tell people to listen to their bodies, and I would lay a lot of emphasis on ChatGPT. ChatGPT, Gemini. I found one. There's apparently another AI, Cloud AI. Please, they're not your doctors. As much as a neurologist might not be an easy access all the time, but like you said, migraines are something that even a general doctor should be able to solve. So always speak to a healthcare professional. You can search online for added support, but don't base your diagnosis based on AI and Google. I mean, once upon a time, you say Google is not your doctor. Now ChatGPT is not your doctor. And just listen to your body. How do you think initiatives like Migraine Outreach is helping to change how migraine is perceived in Nigeria and outside the world?
Initiative like Migraine Outreach, okay, so go for it. Helping migraine patients to reduce stigma. Like we said, we talked about healthcare provider, reach out to medical practitioners, and also create more awareness. And like communities that you created at least has helped online, like you would hear from different people's experience. I think with that.
Maryam.
If I understand the question correctly, you said how migraine outreach has helped with changes, right?
Yes.
That's migraine. There are other things you need to see a healthcare provider in a professional way, and it has also enlightened me as regards to the fact that abusing medication is not good. And you always need a prescription to be able to get some medication, and taking a professional help is important and good, of course, and then maybe consider lifestyle modification. I think those are the changes I've seen so far, and I think it's a good thing. And I encourage that people with migraine should also join the community because it's a good one. Thank you.
Thank you, Maryam. Thank you, Khairat, thank you, Habiba, for joining us today at the Migraine Voices Africa episode here in Abuja. With you all, we are making migrant literate and also visible across our community here in Africa.